Good afternoon and welcome on this day, November the 6th, 2020, to the Board of Education's work session, where we will be discussing returning to in-person instruction. And so I wanted to inform the public that in the event that in the month of January, health conditions allow and our county restrictions are lifted, that the board will resume some type of in-person instruction. We plan to do a hybrid model in the month of January in the event that health conditions and our county restrictions have been uplifted. So I wanted to, at this time, turn the discussion over to Dr. Smith to begin today's work session, the discussion.
Thank you, Ms. Evans, and good afternoon to you and all the members of the Board of Education. This is very important information to our community, to our staff, and across Montgomery County as we talk today about this. Last summer we were in May and June and early July working through this effort. And then as we looked at the metrics and things, and the decision was made to remain all virtual, the staff continued to work all throughout that time. And the board directed us through the months of late July and through the month of August to come back at the end of first marking period with a plan and with a way to move forward, because we know that students need to be in school to the greatest degree possible, and that across our more than 160,000 students, they have vastly different circumstances and different experiences and different needs, and across all areas of life. So the staff's been working a tremendous amount and never stopped working on this effort of bringing students back to school while we were also standing up a full all virtual program. And so I just want to pause here and give a very sincere thank you to every single staff member in Montgomery County Public Schools. They have all contributed tremendously. Our teachers, our teacher leaders, our building services staff, our transportation staff, our front office staff, our materials management and maintenance staff, our IT staff, everyone, and certainly our building administrators and our folks in curriculum and instruction and in transportation and HR, and all of those folks, administrators, support professionals, and teachers, have made a profound difference in what is a circumstance that none of us would choose. And while that sounds trite and cliche, it's absolutely true. People write to me often in their frustration, and I understand that. And sometimes I just want to say to the whole world, we didn't choose this. None of us chose this. And so I'm going to say it right now. None of us chose this. And we're here today to talk about how we can move to the next step if the health metrics allow for this. And we certainly know that the metrics over the last few weeks have not been as positive as we would like for them to have been. Governor Hogan came on the television last night at 5 o'clock and shared a lot of information with everyone. But that doesn't mean that we're not going to continue to plan and work and move forward with our goal and our hope that we can begin to bring students back into the physical spaces that we all think of as school. We're very pleased today to have Dr. Travis Gales with us. He's the County Health Officer and the Chief of Public Health for Montgomery County. He and Dr. Stoddard have been good colleagues and worked in collaboration with us. We've also had a great deal more collaboration with the State Health Department and the State Health Department working with the Maryland State Department of Education. I'm very thankful for that over the last September, October time period, and that is continuing to ramp up to build out a statewide way of thinking about how we manage schools. We do know that a number of school systems have tried to move into this realm, and they either have had to delay that, or in some cases they've had to reduce it or eliminate moving students back into schools. And so it's not a perfect answer, but we have a lot of information to share with the board today and in a series of meetings that are coming up. Those meetings will be today, November 10th, November 17th, December 3rd, the first week of January, as we walk through these meetings and talk with the board about each step along the way. We've also looked at a tremendous number of delivery models across the state of Maryland and across the nation. Palm Beach Public Schools, Sarasota, San Diego Unified. We've talked to Gwinnett and Wake and Boulder, Colorado, and Mesa, Arizona, and Bellevue, Washington, and Beaverton, Oregon, and I could keep naming them. Many times we've been able to talk to them weekly. Some have moved into it and then have had to back off. Others are at the same point we're at as they try to move into this space right now. But this is incredibly important work, and we know it has an effect on every child, on their social, emotional, psychological, intellectual growth and development. And we're very worried. And I have often referenced my own 6 grandchildren and 2 more on the way. How much I worry about them in the different spaces they're in right now in the school experience and what's happening with them in pre-K and first grade and fourth grade and those things. So it is a particularly difficult time, but I am pleased that today we're going to be able to present to the board a framework and some timelines and some metrics and some ways of thinking about this, and then build out on that as we continue moving forward. So I will now turn it over to Dr. McKnight, who will pick up the presentation and move us forward with the staff. So thank you very much, Dr. McKnight.
Thank you, Dr. Smith, and good afternoon, board members. I am excited that today we're coming together to have this discussion, and we're having this discussion with you, and we're going to have Dr. Gales join us. As Dr. Smith mentioned earlier, he and Dr. Stoddard have been working with us along the way and also have been partners with many other districts in learning and consulting about what's working and not working so that can all help to inform our plan. Today, we're going to focus in more detail on the aspects of the health metrics within the context of Montgomery County specifically, and looking at how that fits into the planning and preparation for small group in-person experiences for special populations, and later in second semester for students whose families prefer an in-person experience. Dr. Smith indicated the work of other districts. We have been in collaboration with many, but we've done that to examine and inform our work thus far. We've combined that with feedback that we've gotten from our community in a number of different ways. We've sent out some surveys. We have many of our community members who send us emails sharing information to be considered. So we've taken all of that into consideration. And over the series of meetings ahead, we'll continue to talk about how all of that fits into the work of our design teams. And we've talked about our design teams a number of times, but that's made of many stakeholders, many of our building staff, coming together to provide feedback and information to help be a part of building the plan moving forward. And so we are continuing to work with them to put the information together that's needed to put forth the best plan we possibly can under the current conditions and constraints. At the end of the presentation, we'll be given feedback and instructions on how to submit feedback on what's heard today. We want to hear from our community members. We want to hear from everyone around what is shared with us today. And we're going to strongly encourage everyone to submit their thoughts as soon as possible so that we can take that into consideration on steps moving forward. Over the coming weeks, we will provide more details about the metrics and planning the logistics of supporting an in-person experience. And that feedback, again, is going to be very important to make sure that is shaped in the effort that we put forward as we continue the series of meetings that Dr. Smith just outlined, in which we're going to be describing and talking and discussing and planning what all of this looks like for our students coming back for in-person learning experiences. So that's the basis of the frame of what we're doing today and how that leads into the conversation we're going to have over the next few board meetings. And so at this time, I'll turn it over to Mr. Turner so that he can begin the presentation.
Thank you, Dr. McKnight. And as a reminder, I am not a medical doctor, but I am on the team that helps develop this plan with our county health partners. So I wanted to start by sharing a screenshot of the Montgomery County COVID surveillance dashboard. So first slide, please. Thank you. As the county dashboard shows, there are 2 primary indicators and 4 secondary indicators. I'm going to focus on the 2 primary indicators right now, but you can view the full dashboard at montgomerycountymd.gov/COVID-19. For primary indicator 1, the 7-day average for 100,000 cases per resident, the dashboard shows we are at a high risk of transmission. As of this morning, our county had an average of 14.8 cases per 100,000 residents. To put this into context, at our last board meeting on October 27th, the rate was 11.9. For the second primary indicator, the 14-day test positivity rate, the data show a low transmission risk. The current rate is 3.3. Again, for context, October 27, the positivity rate was 3.1. Next slide, please. It's always important to remind that we are a very large county and that the data that we just discussed is an average of all of our zip codes. As you can see from the screenshot of new positive cases, there are areas where we have more than 25 cases per 100,000 residents and areas below 4. I think it's important to note that the areas that are above 25 are actually different zip codes than what we saw at our previous meeting on October 27. Next slide, please. It's also important to put this in the context of our staff safety and wellness. First, as you see on this slide, we have 115 employees who have tested positive for COVID-19 since March 16th. The second data point, we currently have 25 employees who have tested positive that are currently in quarantine. It's just important context as we consider a return to in-person instruction. Next slide, please. As we previously shared, we've been engaging with our county health officers as we consider next steps moving forward. The chart on this slide is our health metrics matrix for a phased-in return to in-person instruction that is based on CDC guidelines and developed in conjunction with our county health officials. The matrix uses a 14-day new case rate and a 14-day average test positivity rate as the outer boundaries. We've made adjustments to the matrix since the last time that we brought this to the board. And these include adding a crosswalk with a CDC calculation for the average 14-day case rate. We know that there are actually multiple ways to calculate the case rate, new case rate. And so we're showing both. So what is, and for example, if we had a raw number of 52 new cases per day for 14 days in Montgomery County, that would look like a less than 5 cases per 100,000 residents in the Montgomery County, Maryland calculation. And it would look like 70 cases in the CDC calculation. Again, it's the same number of cases, but how it's calculated looks different. The second change we made is that adding that our in alignment with the state, that if our case rate increases by 2 per 100,000 or the positivity rate increases by 1.5% in a period of 2 weeks, that we will have to reassess for the safety of our staff and students. There's one additional change. You'll see new orange boxes in the 5 to 10 category. And in consultation with our county health officer, we recognize that if there is a rapid downward trend of cases from 10 to 5, and we can see that trend moving forward, we can accelerate our consideration for return to in-person if that trend is clear and it looks like it's going to continue to go lower as we move forward with time. Next slide, please. So if we reach the metrics defined here, then we are proposing a phased-in return for special populations beginning January 12, 2021, and if we continue to improve on our metrics, a larger group phase-in beginning February 1st, 2021. And now I'll turn it over to my colleague, Essie McGuire, Associate Superintendent for Operations, to share the strategies for ensuring the safety of our students and staff as we return to in-person instruction.
Thank you. We can go ahead to the next slide. Thank you. So what we want to, of course, as we start to work towards those dates that Mr. Turner shared, we, of course, need to continue our planning and preparation for in-person services. And I want to emphasize again that the foundation for our decision-making on how to implement in-person services will absolutely continue to focus on this consultation with our local health officials, as well as monitoring the metrics we've been describing. As we do that, however, we want to be sure that we can position the system to respond to the changing community health conditions. And we want to do that by implementing and reiterating our core safety protocols, our responses to positive cases when they do occur in our buildings currently, and of course, our preparation of buildings as we look forward to the return of students in person. Next slide, please. The core protocols for safety, really, these are our foundational key elements that do, again, form the foundation for our approach to maintaining a safe and healthy environment in our schools. We know that one important feature is going to be limited capacity in our schools and facilities. Certainly the distancing of 6 feet, and the guidance is still to reduce large numbers together, and also to be sure that individuals can maintain that physical distancing between them. And in order to do that, we know we're going to have to limit the capacity of how many people can be in our schools and facilities. An important element is going to be a health screening protocol for those who do access the buildings. As I'm sure folks are familiar from going to different places, the health attestation form, where individuals are responsible for monitoring their symptoms, acknowledging their current health status and their absence of symptoms, as well as a lack of exposure. That attestation is going to be a very important element and continues to be one now. Face coverings, of course, are very critical. Those are required, and we will provide them as needed throughout our system. And we certainly encourage good hand washing practices and have hand sanitizer readily available, especially at entrances, so that individuals can make use of that as a practice as well. Next slide, please. We are preparing a number of resource materials and information materials for our staff, but also to share with our public around our core safety protocols and practices. We have developed a video module we're calling the COVID 5 Pillars of Public Health Training. Again, it's being developed for all staff members. We anticipate that it will be available to the public also. It really is some reminders and expectations around those health and safety measures that are important for personal safety, as well as they are important for our school and workplace environment safeties, because we are all one community together when we are in these spaces together, and everyone has a role in maintaining that health and safety, both for themselves and for others. So again, we look forward to releasing that as one piece of our resource and informational materials early next week. Next slide, please. Again, as an important piece of this effort, we will also be launching a COVID-19 employee-focused portal. And this portal will include a number of training and safety resources that we will be discussing for employees, as well as information on how employees can apply for any accommodations or leave that may be aligned with state law, federal law, and CDC guidelines that they feel they are eligible for or would like to pursue. So we will have guidance for our employees, and we'll be sharing that information again in one spot where folks can easily access it, and again, have a number of resources as they make their way through the transitional phases that we are entering. Next slide, please. So certainly personal health and safety supplies are very important, and they have been provided for all staff members that are in buildings currently. We are continuing to provide those deliveries, to work with our principals around the materials that are in schools, and we plan to replenish those on a quarterly basis in order to have a regular distribution, but we also will work with principals if there are additional needs that come up in between those regular distributions. Certainly a good supply of masks are included. We provide those on an allocation that takes into account the numbers of folks in the building. But we also want to have supplies of disposable masks that might be needed throughout the day and might be needed for anyone who enters the school building. We want to be sure we have those on hand. And again, certainly plenty of hand sanitizer, as well as other cleaning materials for the building, gloves. And then we do have a number of more specialized equipment for certain program needs, or again, a number of specialized interactions that may occur. Next slide, please. I do want to talk a little bit about our work right now when we do have an employee with a positive case that is reported to us. We do, of course, have an existing process, because while we do not have students in person in our buildings right now, we have a number of staff to continue what are our core essential operations and be able to provide services, food, and materials to our staff and our family and our community. So when we have a confirmed positive case in an MCPS facility, What I do want to emphasize most is that our first line is to call the Montgomery County Department of Health and Human Services. We work very, very closely with our public health colleagues, and we so appreciate their consultation and advice to us. We are not public health, and we do not want to be public health. What we do, however, is work closely with them to identify where our employees are in our buildings, which employees may have had contact with each other, and what the impact is on MCPS operations. So our work with them around contact tracing does follow the public health guidelines, and it does follow those requirements. However, again, we do not replace public health's activities around contact tracing. We work with them and we supplement any information that we can share with them around our employees. It also helps us at that point to, again, be sure that we can reach out to our employees quickly and safely, in addition to protecting their employee privacy. We take that very seriously, and we absolutely make every effort to safeguard our employees' medical privacy through this process. So again, we work very closely with public health. We work with our employees to understand the extent of exposure and the extent of who may, again, be impacted. And then we do have some template communications so that we can let everyone know to the extent that we are able to share, again, protecting employee privacy. We are able to let people know what the status is of operations in the building, whether they need to quarantine or are able to return to work. And then we also, again, of course, clean and take care of the physical plant in the building. Next slide, please. Again, this is at heart, obviously, a public health activity and a public health responsibility. However, we have worked with our public health colleagues to prepare some resource materials so that our employees, as well as the public, can have some more awareness of the processes that are involved and of the steps that are taken. So again, early next week, we'll be able to share some process maps that relate to the processes I've just described for our employees as well as for our supervisors. We do anticipate being able to share those publicly as well, again, just so that folks have awareness of the processes that we're engaged with. We also are developing and finalizing a little more of a thorough walkthrough of the processes for supervisors, and we'll be following up with supervisors and principals around those training materials, as well as to answer questions from them as they, again, are learning more about these processes. And as I mentioned, we certainly have template communications that we'll be sharing with individuals to work through as well. Next slide, please. Certainly, one of the core pieces that has been on our mind for quite some time is the building preparation. Because what we do know, again, because of the health and safety requirements, we do know that we are going to have some work to do to set up our schools and prepare them for students to come back. We have done a great deal of work over many months to really look at best practices, look at how those health requirements are operationalized in buildings, and we have shared with school administrators information and guidance, very high-level parameters on how to think about planning for in-person activities in a school building. And so between now and over the coming weeks, we absolutely know that we'll be working with our schools to convene a small planning team. The other thing that we know is that each school is going to have to plan with attention to its own needs, its own layout, and absolutely be attentive to the details that are needed in that school. We have provided a readiness checklist, again, at a very high level, and are working through additional resource materials that can provide additional detail as we work through that process. We've worked with our colleagues in teaching, learning, and schools to identify 10 schools that we want to set up as physically distanced models. And we'll be starting that work with our schools next week. Those schools will really serve as regional models and best practice, again, sort of ideas and models and approaches that other colleagues can share with each other, can come see that site either in person or virtually. And again, just talk through those practices of setting up buildings together as we work through those next steps. Next slide, please. One area of building setup that has had some questions relates to signage, and certainly we do have a number of standard signs in terms of, again, a lot of health reminders, which we did not reproduce here. What we've shown here are sort of those directional reminders, the distancing reminders, a number of those kinds of durable physical distancing reminder products for both inside and outside are available. And we've worked with our schools to ensure that we have a central allocation that reflects the dollars that schools would need to be able to order signs that reflect the school level as well as the size of school. And again, wanting to be sure that we are addressing schools equitably so that everyone can access the level of signs that they need. Next slide, please. I would like to hand over the presentation to Mr. Seth Adams, our Director of Facilities Management, who's going to speak to the work that we are doing around our HVAC systems in our schools and the air quality standards that are important for us, again, as we look to increase in-person experiences in our schools.
Thank you, Ms. McGuire. So yes, a critical part of the building preparation is the air quality in the spaces. So I want to just capture what some of the existing conditions are, as well as highlight the reopening guidance in this area. So one thing that we did want to certainly be clear about is that our systems are designed in a way that meets the fundamental elements of HVAC and ventilation, and that's certainly a good starting point from where we are. You probably heard from many other jurisdictions and other areas where they're struggling in this area. And while we do have, concerns and we have equipment that needs attention, we certainly are in a much better starting point than a lot of our neighboring school districts and state school districts. So one of the things I wanted to highlight is obviously the COVID guidelines really focus on increased air exchanges, increased outdoor ventilation, and increased filter efficiency. And one area that is key from an important standpoint is this notion that a good supply of outside air to dilute indoor contaminants is the first line of defense. So certainly that is critical in our work as we build out a plan forward. So our approach to achieve these guidelines is to upgrade the unit filters, clean air handling systems and distribution, and adjust operational controls to obviously increase ventilation and increase operational runtime. And in addition, where needed, to install and place portable air cleaners, air scrubbers, to supplement the work around ventilation and filtration. Next slide, please. So what we have done so far, certainly a big part of this is system evaluations to review each of our schools and our equipment for this transition from where we are in past to a higher efficiency filter approach. This also has included review and testing of air cleaners for both effectiveness and acoustical impacts. There's a lot of information out there about what to do in classrooms, but certainly when you start to place equipment in classrooms, it can have unintended consequences. So some of the equipment we've tested has had some pretty negative acoustical impacts in classrooms. So those certainly are not some of the devices that we want to pursue. In addition to this, we have started purchasing of filters back in the summer, and we continue to increase our purchasing around that to build up our inventory as we move forward. Next steps obviously are to form teams from maintenance, building services, construction, and transportation to really focus on individual school buildings and the transition and filtration and operations. A big part of this is communication. So we'll continue to work with our building service teams and building service managers to highlight areas that need attention, to obviously focus on equipment that needs work order attention or repair or replacement in some cases, and really start to implement in a way that makes sense as a school district and not necessarily just from an individual depot or region, but from a consistent school district perspective. Next slide, please. So what to expect is, we are developing schedules of about 25 schools per week where these teams will come through to work with in every single classroom. This will include everything from filter replacement to placing air cleaners. This schedule, as well as updates of our work, will be published on our Department of Facilities Management website. So this will not only be available to our teachers and administrators, but also to parents as we continue through this work. Obviously, This will take some time. So some schools may take several days, others may be quicker, but the work will be start to finish, and we will obviously be there throughout the process. And a big part of this, obviously, is to answer questions of administrators and building services to make sure everyone understands what we're doing. What are the what are the outcomes of what the work will look like, as well as what questions to ask if things start to look slightly different than what they had anticipated. So obviously, with this work, there will be potential changes. Changes to how systems operate. These changes could be, obviously, if you think about it, more outside air coming into classroom spaces, particularly in the winter months, could result in some lower temperatures. So we'll be monitoring these conditions throughout, and obviously working with our administrators and building services to remediate any of these concerns. I would highlight, though, that this is a focus on filtration and ventilation. And while we do understand that there are pieces of equipment that need repair, we will obviously have great focus on this. But I would say that temperature is not a sort of a good indicator of a functioning system. We are going to be looking at this from ventilation and filtration, and there may be temperature challenges along the way with that, but we certainly will be working to remediate as we go. Next slide, please. So with that, we turn it back over to the board for discussion of this portion of the presentation. Thank you.
Thank you. So I will start with Ms. Silvestre.
If we have questions about the metrics, should we wait for Dr. Gales or should we ask them now?
It might be more efficient to wait for Dr. Gales at the end, and then we could take all of those questions at once, if that works.
Okay. That's my main concern is the metrics. So
we'll have you wait then. Okay, thanks. Mr. Asante.
My one question was about the health screening. I know we can't test every student, so is our main mode of ensuring students are healthy, is that going to be temperature?
So the health attestation, certainly temperature is one piece of that. We do, again, one of the questions is absolutely to again verify that an individual does not have a temperature. The other questions relate to symptoms, to other symptoms of COVID-19, which, many of which do, of course, mirror cold and flu symptoms around a cough or congestion, but also some very specific questions around smell and taste. That is one indicator that we're aware of. But again, those questions come directly from the CDC and the health offices. And then another question is just, of course, around any known exposure that an individual may have. So that is the health attestation process encompassing those pieces.
Thank you.
Vice President Wolf.
I had a similar question, I think, around the health screening protocol. So if I'm understanding you correctly, it will be the parent providing this information regarding temperature, symptoms, and any other issues that the CDC recommends you check?
Yes, that's correct.
You believe that that's reliable, the most reliable way to get that information?
So that's certainly...
I think I've expressed to you before, I have real concerns about parents providing information, because I think any of us that have worked for long periods of time have probably sent the kid to school, given them some aspirin and said, call me if it gets worse. So I'm always a little skeptical about relying on the parent's assertion that the child is feeling okay. Stop.
So certainly understanding that is the first approach, and it is again an approach and a practice that is recommended. We will also, of course, have health services supporting our schools. That is a requirement, and we will be having that. And so, of course, an important element is around that protocol in the building. We are required under the new guidelines as well to have an isolation room in the building. And so if there is a question at school around an individual's health status. We'll be dealing with that in the school environment, and again, working very closely with our colleagues around that. But your point is well taken that, again, all of these measures do require everyone to follow them and comply and work together, and to acknowledge that that we all have an effect on each other at this point.
Just one follow-up. Health services, is this going to be at every school, or is this going to be a visiting nurse? How is that going to work? Maybe you don't know yet. I don't know.
So we are going to speak to that a little bit later in the presentation.
Okay.
But certainly what we do know is that COMAR does require that we have school health services, and we'll be exploring models to support that again, but we absolutely will meet that requirement.
All right. Thank you.
Mrs. Spondrowski.
Thank you. I think, my biggest question is around the matrix. So I will wait, obviously, for that, or the metrics, sorry. The air quality issue, I did want to just ask if we are finding that we're having a hard time getting the work done ourselves, have we looked in at all to bringing in any other companies or anything to help do that work to make sure that everything is where it needs to be for the sake of our students and our staff?
Certainly, that is a great question, and absolutely we are pursuing independent firms to assist in this work, both from sort of the labor part of it, meaning the cleaning and filter replacement, but as well as from equipment. And you think about air cleaners. There's every school district in the nation is grappling with air filters, air cleaners, and there's competition for this. So as we run into shortages, we will be leaning on our industry partners to help with this. And so from a board perspective, I would say please look out for awards of contract in the future in this work.
Okay, I appreciate that, because I think it's going to be really overwhelming, and I know it's a top priority of concern for a lot of our staff, especially. So thank you.
Ms. Dixon.
Can you hear me?
Yes.
Faded away. Yeah. Okay. Thank you. So I just wanted to say thank you to the staff for all the work that you've done on this. I really do appreciate the attention to detail, which is evident in the presentation. I had printed this out and am wondering whether we could add a little more specificity to the Tuesday, January 12th, that begin special populations phase in. Could you elaborate on that, who those special populations are? Which students are we talking about? I mean, I know what, special populations are, but can you say specifically who you're thinking of here? I think the public would like to know.
So I'll jump in here. We'll be speaking about this later in the presentation and laying out the phases for both the special populations, but also discussing the groups for the second semester.
Okay, so you will share exactly which groups of students we're talking about. Okay, yeah. All right. And the other question that I had was the schools that are going to be set up, the 10 schools as regional models. Are you going to tell us that? Who are those 10 schools?
We'd be happy
to.
I'm sorry,
okay.
We'd be happy to. I'm sorry, Mrs. Dixon, I didn't mean to interrupt.
No, go ahead. Go ahead, Essie.
So we would be happy to. I think what we would like to do is share that information next week as we continue to just work that through, and with our colleagues a little bit further, we would be happy to be more specific as we roll those out. Okay.
Because I would really like to go to visit one, before I leave. But I do think, that the public would like to know that. But once again, there's obvious a lot of planning went into all of this. And so I think the more information we can share sooner might cut down on some of the emails the board receives in terms of, when are we going to do this and when are we going to do that? So thank you very much.
Thank you, Dr. Baca.
I just wanted to thank you for the presentation, and I'm very aware, I think we all are, that you've been planning for the last 8 months on not just you, but everybody on the staff for getting back either to hybrid or full in-person meetings. So I just want people to understand that the planning has been going on, and I think you've reflected that in all the things that you're saying for us.
Mrs. O'Neill.
Okay, there I am. Yes, I agree that, I think people are not aware of all the efforts that have gone on behind the scenes. And I did really appreciate visiting College Gardens back in July as a model. And I look forward to you setting up those other models so people can see it. There are still a lot of conversations out there about with rumors, a teacher with a face shield will go so long without a replacement or masks. And there are still people who are insistent that teachers will be providing their own PPE. And I had a conversation with a group of parents who said they had heard that there would be only 3 automated hand sanitizer dispensers per school. And what about our largest schools? Can you sort of set aside those rumors? I mean, when we visited College Gardens, you shared that not everybody would be going in or the thinking back in July was not everybody entering the school from one entrance. And that in every classroom there would be hand sanitizers. If you answer, just where are we on the automated hand sanitizer, and are we going to be in a rationing situation?
So the short answer is no, we are absolutely not going to be in a rationing situation. We are procuring supplies very continually. We are not stopping because, again, we certainly know, and as Mr. Adams was sharing, certainly every school system is looking for materials, so we are not alone, but we have a very robust inventory. For example, at this moment, we have over 500,000 face coverings on hand right now. And again, we're not stopping, but that certainly is going to be more than enough to get us started with our initial allocations and then some. We certainly, many individuals will bring their own face coverings because they like them, and that's fine. But we will absolutely have those available to distribute to everyone who comes into the building. That is non-negotiable, and we will have that. And again, that's just an example of the kind of inventory that we have on hand now and will continue to procure. In terms of hand sanitizers, similarly, we have a large range of types of dispensers. We do have some of the automated dispensers. We have some of the very large jugs. We have many of the small ones to have in classrooms as well. So we have a range. The automated ones are absolutely intended for those entrance points. That's sort of the primary area that we expect to deploy those, and we'll be working with principals. We've started by providing those at every school. Again, understanding that at this initial moment, what we have our employees and operations going on in schools, we can be following up with additional deliveries, and we will be following up with additional deliveries. So again, we're really looking at a range of materials, a range of types of materials, and we absolutely will be working with our schools around what specifically is needed for operations when students come back. But we absolutely have a robust inventory. We are continuing, we are not stopping on procuring, and we will continue to roll materials out as folks are in buildings.
Okay. So at this time, we will go back to Ms. Silvestri. I didn't forget about you. Yep. I was coming back to you then.
Yeah, I did have a clarification question about the slide with the metrics. Did you explain the difference between the Maryland calculation model and the CDC calculation model? And if not, where can we get more information? Because I don't understand the difference. If you could state what is the current number I see the greater than 5, 5 to 10, 10 to 15. What are we today?
So today we are for the 7-day average at 14.8, I believe, cases per 100,000 on the 7-day range. It's a little bit lower for the 14-day range because we've actually followed the CDC model. And so that's where we are on this list. And that's, roughly 150 some cases per day. If when you do the calculation. So again, there's been multiple models of how folks do the calculations for 14-day averages. Not sure how everyone landed on their own, but we want to make sure that people could see both depending on which guide they were looking at.
So where can I get information on how, or can you explain what's the difference between the Maryland calculation and the CDC?
So the Maryland calculation does the math in terms of the 14 days, and they go for the daily average of those. So it's if you had, say, 52 cases a day, you divide that by, and you say, so the average of, say for 14 days, you have 52 cases, right? So for those 14 days, the average is 52 cases. We have 1.05 million residents in Montgomery County. And then you divide that by the 100,000 residents. And so you get roughly 5 cases, but it's like 4.98 or something along those lines per 100,000 residents. In the CDC model, you take the 52 and you add it together by 14 days. So it's 52 times 14 essentially, which is 728 as the number you go with. Then you divide it by 1.05 million and you multiply by 100,000. Again, this is complicated math that takes quite some time. And that's why we're trying to simplify it for our community by developing this crosswalk so it's easy for folks to understand.
So what we hear in the media is for example, 150 cases per day. That's what we hear. I see in Bethesda Beat every day, the reports. So how can we make this more understandable for our teachers and our families? Because this does not make sense to me. And I don't want to have people having to do math the Maryland way and the CDC way to understand where we are. So that's just my feedback for today. This is not working for me. I think we have to work a little bit to make it more comprehensible to the way that people are getting their information, which is people are getting the daily case rate. So if there's a way to make this a little simpler, I would appreciate that.
We're happy to add that in.
Mrs. Spondrowski.
Yeah, thanks. Along those lines, since we're talking about the metric stuff now, I agree 100% with everything that Ms. Silvestre just said. I think that it's hard, and I'm assuming that everyone has seen, what's going around on social media and in the emails with the metrics for all the other, or most of the other counties in the state of Maryland, and how it makes ours look much different from the other areas, much more, I don't know if you want to call it strict or restricted. If what we're following is a Maryland metrics, where are people getting these from?
So I think Dr. Gales. Oh.
Sorry, go ahead, Mr. Turner.
I'd say Dr. Gales can speak to kind of the level of threshold that we came to as we were thinking about the safety of our students and staff. But I also say that's the person who created this, or the group that brought this forward, did a little kind of cherry picking of data and making some assumptions about what fit into what category. So again, as we talk about this, we'll see exactly where we are and our thresholds and why we pick those thresholds.
All right. I just wanted to add, Dr. Gales, if we could say some of the metrics for the end of the presentation when Dr. Gales joins us, he'll be able to give a little bit more background on how this fits into the state average and then how that then fit into the county metrics, because what we wanted to do was be able to have a metrics within the school system that reflected metrics within Montgomery County, knowing that we were all taking guidance from how the state came up with their system. So if that's okay with the board, if we could just hold some of those questions about metrics until he comes, I think that'll, okay.
That's absolutely, I thought maybe he had joined. I started flipping through the screens to see if he had joined because I thought we were waiting till he came in to talk about it. So it's fine. I just was curious because I agree with Ms. Silvestri in that this isn't going to be okay for our parents just as it is. So it'll be better if we can have that conversation when he joins us. Thank you.
Thanks.
So at this point, we're ready to continue on with the presentation and it's in this portion of the discussion for board members. So go ahead and proceed. Thank you.
Okay, at this time, we'll turn it over to Mr. Moran.
Thank you, Dr. McKnight. Good afternoon. It's great to be here with you guys today. So I'm going to be talking about our learnings. Through planning and preparation, we've learned a tremendous amount to develop a strategic plan to begin to return groups of students. A part of this learning has been exploring the work of other school systems throughout the country and learning from their experiences and challenges, as Dr. Smith indicated. The foundation of this plan will and must focus on the social emotional well-being of every student. As we have studied other school districts, we have learned that while returning to in-person learning is critical, the experience of social distancing has been traumatic for some students. Stressors from the need to become reintroduced and reacclimated to the social setting of a classroom have been evident for many students. These stressors from being isolated have only been intensified for many students as they've been exposed to racism and the civic turmoil in our society. Therefore, reestablishing relationships and reconnecting classroom communities must be a primary focus of our strategic plan. During the November 10th Board of Education meeting, we will be providing more information and specifics on our plan that has been developed to support the social emotional well-being of students, staff, and parents. As a result of our research and discussions across groups with differing perspectives, we will be examining different in-person learning experiences. Relative to these experiences, we have learned that we need to be prepared to consider utilizing current or supplemental staffing in ways that will support these models' success. These staffing alternatives could be utilized to support student supervision, help facilitate student participation in classroom discussions, or as we learned from Sarasota County Schools, adapting or adopting teacher teams so that one teacher provides in-classroom instruction while the other teacher teams with them to support those students that are virtual. This staffing model provides the opportunity for these two teachers to team from the planning phase to determining opportunities for differentiating learning to achieve the same learning objective. An additional learning is the need for well-planned and well-timed professional learning to support these teams of teachers. Next slide, please. As indicated on the previous slide, we have learned that we must embrace the understanding that we need a toolbox of in-person learning experiences that are implemented by schools based on the needs of their students, their staffing, and the content that is being delivered. There is no perfect model. School systems such as New York City Public Schools have experienced tremendous challenges because they attempted to apply the same learning model to all schools. Their attempt to promote a one-size-fits-all strategy for the optimal model of learning resulted in setbacks because it didn't account for the differences in school communities and therefore empower school leaders to work with their staffs and families to select the best model for them. While there are different models that we will discuss today, they share the same goal: a coherence of instruction, a continuity of learning that flows between the in-person learning experience and the virtual learning experience, ensuring that the sequence of instruction honors the academic and social needs of all students. Later in the presentation, we will present on a model that we believe provides the greatest coherence possible, a simultaneous learning model. We have learned from studying other school districts that a major learning tool for them was having a structured approach to assess student understanding of content they received virtually when they returned to their in-person learning experience. Next slide, please. A key driver to enhancing the in-person learning experiences will be the priority of keeping students learning in their home school from their current teacher and with their current classmates. While this is a priority, the results from the parent questionnaire will inform our capability to the extent that which we are able to do this, and models may differ from school to school or even grade level to grade level. In regard to the location of in-person learning experiences, we have studied school systems that have had all students go to their home school in school systems such as the San Diego Unified School District, where one cohort comes in the morning and another in the afternoon. This model presents significant operational and health challenges. Another model that we have studied in school systems that have established regional school locations to account for operational challenges to ensure student and staff safety. Next slide, please. To frame how we have been preparing to phase in students, I'd like to refer to the 4-quadrant chart. We begin with the foundation of what drives these instructional experiences, the who, the student groups that will be invited to return in each phase, and the staff that will be present to provide teaching and social emotional supports. As we look at the what, it is first the interpersonal and emotional supports that students need as they become reconnected through the in-person instructional experiences. This is followed by the content that students need to master, more specifically the skills and standards, regardless if they are in person or virtual. This transitions us to the where, which we discussed on the previous slide, which school sites and the frequency they are being assessed. And finally, today we're going to talk about the how, the in-person instructional models that we have been studying and experimenting with that will provide the coherence of instruction that I spoke to earlier. In addition to these instructional models, we will touch on how these models will be supported through the utilization of current and potentially adding additional staffing. Next slide, please. Before we talk about these phases, we'd like to share what will occur over the next months if we meet the necessary metrics. On this slide, you will notice that returning to in-person instructional experiences will begin prior to the start of the second semester. In December, assessment centers will open. In January, discrete special education programs at the elementary, middle, and high school levels will phase in. Additionally, select career and technology education programs will return. Then in February, we'll begin with the second semester phase-in. At this time, I will pass it to Mr. Lowndes, Associate Superintendent for Special Education, to discuss students phasing back in greater detail.
Next slide, please. Thank you, Mr. Moran. So today I'm very excited to be here today to talk about the phase-in for special education services, programs, and schools. We'd like to begin in December with the launch of 3 assessment centers. I just want to remind folks on the call today that IDEA, the Individuals with Disabilities Education Act, has not relieved any of the timelines for school systems during COVID. And therefore, we're still required to assess students to determine whether they meet the requirements for special education services. Our current educational assessments and psychological assessments do not work well in a distance learning format and have not been normed. And therefore, we need to get back into in-person when we can. And so these 3 locations, one up county, Halliwells Middle School, one mid county, Julius West Middle School, and one down county, Sligo Middle Schools, will allow us to bring students in and have some in-person assessments. We'd be doing it based on appointment only, and it would happen during the day, after school, and on the weekends to help us catch up with our assessments. We do understand that it's going to be difficult for our teachers to get there during the day because they're already teaching in the distance learning format. So we will be working with OHRD to help us staff the assessment centers during the day. If we can go to the next slide, please. So when we talk about phase-ins of our programs, we have 3 different phases. The first phase we'll begin with the autism program, the extensions program, the school community-based program, and our special schools. When determining when these programs should phase in, we had some considerations, and the considerations were the level of support required to access the virtual instruction, the technology supports, the instructional supports, and the behavior supports. And we also looked at the class sizes and the ratio between the number of students to the number of adults in the building, both the teacher and the paraeducators within the classrooms. And we were looking to begin the phase 1 with a small ratio between our students and our our teachers and our paraeducators. And if you look at phase one, you're going to look at it that it does include our students with the most significant supports needed in the distance learning format and within the in-school format. And so that's why we chose those programs to come in first. Next, and based on the health metrics and how things go, we would then look at bringing in phase two and phase three. And once again, this is all determined based on that it's safe to bring back our programs during the time that we are trying to bring them back. Go to the next slide, please. Now, the safety of our students and staff is our number one priority. And I do want to say that we have consulted with many resources to look at the types of PPE and the structures that we should be bringing our students back in. And we consulted with the CDC guidelines, the Harvard School of Public Health Safe School Openings Guidelines, the Harvard Medical School literature on the latest PPE and how it should be used and when it should be used, webinars for students with disability and how to return them safely. We've spoken with the Fort Lewis College School of Public Health and talked about with them directly how to bring students back that are going to have a difficult time with social distancing and wearing masks. We've consulted with our regional school systems that have begun bringing students back. And we've also consulted with the Crisis Prevention Institute to make sure that we will have a safe program to work with students that have some difficulties with behaviors. The first thing I would like to talk about is the PPE. And so the programs that we're going to bring in phase one will have students who won't be able to socially distance or wear masks at all times. Therefore, we have additional PPE available for all staff members directly interacting with our students throughout the day. This will include our classroom teachers, our paraeducators, and our folks that are transporting our students. And we'll also look at other folks within the building that might be providing supports during the day and making sure that they have the appropriate PPE. And the PPE will be above and beyond the PPE provided for all our staff that are returning to schools. The other thing that we're looking at, and we've found that has been very helpful to keeping staff and students safe, is cohorting the classrooms within a building. We understand that there's times during the day where staff need to support one another in other classrooms. And the way that it's been done successful in other places is that they've grouped 2 to 3 classes together. And so you have a group of teachers and a group of students that are together, and they will remain together and they will support each other throughout the school day as they need help and support. Next slide, please. So it's not only important for our staff to have the proper PPE, but they also will need the proper strategies to be safe and to have a successful return to school for our students. What we've learned through some of the other schools and programs that have returned is that some of our students take a little while to remember what it's like to go back to school. And therefore, it's important that we train our staff before they go back and start working with students how to de-escalate some behaviors that might happen when our students go back. Once again, we're working with our CPI partners to provide a physical intervention training for our staff before our students come back. The other thing is we heard today about the schools having some model setups, and we're also going to have some model setups for the programs that are coming back. And we've looked at some models out there, and we will be able to provide our principals and our teachers with a model within Montgomery County for them to come and look at and understand what it looks like in a school building. The other thing we want to make sure that all our staff get is the training on personal care and hygiene support. And so we'll make sure that all these trainings happen before students come back, and we're working with our various other departments within Montgomery County Public School, including the facilities department, to make sure that we're able to find safe places to have trainings in person before our students come back. Now I'd like to turn it back to Mr. Moran to talk about other small programs or groups of students that are coming back in January.
Thank you, Mr. Lowndes. So as you can see here on this slide, one of the first groups in secondary are students that participate in these specialized career and technology education programs. These programs are better suited for in-person engagement in order to prepare for the assessments and meet the certification requirements. Next slide, please. So on this slide, we outline the who through a set of 3 phases at the elementary, middle, and high school level. Under phase 1 at these 3 levels, specific special education programs will be invited to return to in-person learning. In addition, at the elementary level, kindergarten and grade 1 will be invited to return, and at the middle school level, grade 6 will be invited to return. In addition to students in specific special education programs at the high school level, grade 9 students will be invited to return. Grade 12 students that are enrolled in career and technology education programs and require that in-person experience to fulfill those service hours will be invited to return. During phase 1, we will closely examine the successes and opportunities for growth to make necessary modifications for phase 2. One of the key areas will be the elongated arrival and dismissal schedules due to bus capacity limitations and how these findings will influence phase 2 as we add additional students. As with any instructional model, and specifically during a pandemic, additional human resources will be required to balance student needs, whether in person or virtual. Donna Redmond-Jones will now share strategies for how we will access these additional human resources.
Thank you, Dr. Moran, and good afternoon to everyone. So if we could go to the next slide. So as Dr. Moran indicated, when we're planning for some of our students to remain in all virtual, while some groups of students are accessing different instructional models, we've worked closely with the Office of Human Resources and Development to ensure that we are recruiting additional staff, additional teachers in preparation for that anticipated need. And it's not just an anticipated need with MCPS. We realize that we're in competition with other districts who will experience similar needs to be able to support 2 or varied instructional models at one time. So we just wanted to highlight some of those recruitment efforts. There's a lot of focus, of course, on the December graduates. And so whether it be through recruitment efforts at colleges and universities, through efforts through LinkedIn, or even meeting with our teacher interns, both MCPS interns as well as teacher interns in surrounding districts, we are working hard to recruit those December grads. In addition, we've looked at retirees, sort of an all call to our retirees or any substitute teachers who hold a BA degree who might be prospective teachers for us. We've also been marketing to those prospective employees who expressed interest in coming to MCPS, but were not picked up for this year. They might still have that interest, and we're looking at marketing to them, as well as those who might live even outside of the area, understanding that we have both, in-person and virtual experiences to support, so people outside of the area are viable candidates as well. And certainly we could look at some of our current paraeducators, although that would sort of be very limited because we wouldn't want to interrupt our current educational programs. Next slide, please. So essential to the detailed planning of phase in to some in-person instruction is understanding what parents' preferences are in terms of what they want for their individual children. So we are proposing that next week we want to launch a parent preference survey. And that would be an opportunity for a global registration. Every single parent would receive and be asked to please complete this survey so that we can have a better sense of the locations and the numbers of parents who are either most interested in having their children remain in an all virtual instructional model, or if they want their children to be able to access some in-person instruction. So we realize this is a significant choice and selection for families. So the proposal is, as this survey, at the same time that this survey is sent out, that there will be a guide, really succinct guide, to be able to put forth some considerations that families have and can make in trying to determine what might be right for their individual children. So for example, it really is a highly personal and individualized choice. So we don't want families to think that they have to make this choice, one choice for all of their children. A family might say that some in-person instruction is helpful for their elementary school age student, but for example, a virtual instructional model might be preferred for another child in the family. And so it really is a choice for each individual student. Another piece is that all students, regardless of instructional model, will still access the extracurricular activities and the athletic activities available. So for instance, if I'm a parent and I choose for my child to remain in an all virtual instructional model, my child can still access extracurricular activities and athletic activities, even if we get to a point where those activities become in person. So students will all be able to access extracurricular and athletic activities regardless of the model that parents choose. We also want parents to know that the logistics of what will be planned when we think about the details of any kind of in-person models, the effort will be made to maintain the same teacher that the student has currently, but it could be that those logistics don't work out. So that's also a consideration that we want parents to make. Every effort will be made to ensure that the teacher is consistent, but we want parents to know that it could be that logistically that is not feasible. So those are some of the things that would be a part of the guide so that parents can be able to make an informed decision. The other thing parents frequently want to know is, there could be limited situations in which parents want to change their minds. It is so important that we get all of this accurate information from families, because this information about who wants to remain all virtual versus who wants to be able to access in-person instruction, this information drives all of the details of the planning. But we realize that there will be times that parents want to change their minds. So there will certainly be a process for that. The easier change is to go from being in person to going all virtual, because that's just an easier transition to make, and so can be made more immediately. Changes in the other direction from an all virtual model to deciding to have some in-person instruction definitely has staffing implications, has transportation implications, and so that here again will be evaluated as we are able to work out those logistics. Next slide, please. So the proposed parent preference survey would go out to families on November 11th, next week, and that survey would be open from November 11th to December 3rd. And here again, an accompanying parent guide would go with that. Parents, we realize that here again, we want to do a massive outreach in multiple languages to make sure that parents are able to access the survey in ways that are easiest for them. So the selection is online in terms of the outreach. It is through mailing and telephone calls and texts, and definitely in multiple languages, because we know we want to reach all families, and we realize how important getting that information from all families truly is. So the responses from our families here again determines what our plans will be in terms of the transportation needed, in terms of school locations. Is this something that is opening at every school? Is it at some schools based on, here again, the interest of our families and the instructional delivery models? As Dr. Moran stated, really it has to be, there has to be some flexibility in that, as the logistics about which students are being served in some form of in-person helps to really drive that model for instruction. The next slide, please. So the questions, and this is just to reemphasize, the questions here again, really it's a very short and succinct survey that would ask parents to select an instructional delivery preference for continuing all virtual or electing some in-person instruction. And it would ask parents to please select whether transportation would be required in the case of the parent selecting a preference for some in-person instruction. So just to conclude, it's so important. This parent preference survey really drives the detailed planning. And it is so important that we get this information from our families so that we know where we stand right now with what parents prefer in terms of the instructional design model for their children. Thank you. And I believe Ms. McGuire is coming next.
Yes, thank you. If we can go to the next slide, please. I want to take just a moment or two to speak about transportation. Certainly, as we were hearing the question around whether parents will select for their students to ride the school bus in order to come back to an in-person learning experience is a really critical question for us in our planning to provide transportation. And as with our buildings, we do know that we will have to limit the capacity that we have and our ability to have numbers of students on our buses. In our initial planning, and this was true across the board in other jurisdictions as well, folks were planning around having assumptions based on one student in every other bus seat. And typically that is a configuration that results in a physical distance of approximately 6 feet, which is of course consistent with the guidance that we have on physical distancing. That does limit the capacity of our school buses to 11 students, which is just under 25% of our normal operating capacity. And as we continue our planning and as we continue to look at what our sister jurisdictions across the region and across the country are doing, what we understand is that that level of capacity could severely limit our ability to provide transportation to all students at all levels. What is very interesting to us is that most jurisdictions, and in fact, the vast majority of districts that we are working with, are using an operating assumption of one student in each bus seat. Every district in Maryland that has come back has taken that approach, or in fact, even an approach of more density on buses than that. Our understanding is that Fairfax County is planning on this method. And again, if we take that approach of having one student in every seat, that would limit our capacity to the bus at about 22 students, which is just under 50% of our normal practical operating capacity. Certainly, that still is a reduced capacity. It still reduces the number of students on a bus and it allows for some distancing among students. But it certainly would increase our ability to provide transportation to all students at all levels. And so as we continue planning, we're really going to need to continue to consider what the right operating capacity is for MCPS and how that operating capacity matches to the number of families who are selecting school bus transportation for their students. Next slide, please. I do want to emphasize that regardless of the operating model that is our approach, there are core safety practices that will be implemented across the board in our school buses. We have invested in sprayer systems so that the entire bus can be cleaned very thoroughly following each day. High touch areas of the bus will be disinfected by bus staff in between each route and each load of students. Of course, we will have the other personal protective measures of hand sanitizer and face coverings. Face coverings will be required. As we do know, though, there are some health conditions in which a student may not be able to wear a face covering. And so we certainly will work with those cases as well. And bus staff also will participate in the health assessments that we have been discussing. Next slide, please. We spoke a little bit earlier regarding school health services. Again, we are required by state regulations to provide school health services to support students in schools and in-person learning. And certainly we will absolutely abide by that requirement, and we know how important that is in any year and certainly in the current conditions. Normally, our school health services are provided through staff that are part of our Department of Health and Human Services here in the county. And so we are continuing to work with our colleagues in DHHS around the availability of staff, but also around supplies and equipment and how we need to set up and operationalize those services in our schools. Again, we do have guidance from the state regarding isolation rooms and other practices, and we'll be working to equip those rooms as needed and also to set up following those requirements. We are exploring multiple models of how we can ensure that we have the required school health services in all of the school sites. And so again, it will be very important for us to understand the scope of students and families that will be returning with us to school so that we can ensure that we have those services to support that in-person learning. Next slide, please. And finally, the very important question of school locations will also be determined by the results of the parent question survey on whether students will be returning to school. Once we have that information, we'll be able to really very carefully analyze and determine what school locations are needed to serve the students who are requesting an in-person model. And again, as was spoken to earlier, we do know and have certainly benchmarked with examples that we have seen implemented in our peer school districts regionally and across the country, where folks are taking a range of approaches. Some districts are opening every school location if that is warranted. Other districts are finding that perhaps there are specific locations that are required based on demand, or perhaps that a regional hub model serves the demand of services that has been required. But regardless, what we will do is seek to match very closely, again, what students and families are selecting and requesting for in-person with all of the support services that we've been speaking about today. And with that, I would pause again for any questions from board members on this section of the presentation.
Sure. Thank you, Ms. McGuire, and to everyone that presented. I will start with Mr. Asante.
Yes, thank you for the presentation. Like my colleague said earlier, I think it's quite evident to see all of the work that's been put into planning all of this, even just like comparing it to the original plan from the summer, all of the updates that have been made. I had two questions, but I did want to comment first on the phasing in for high school students. I think it would be beneficial to put our seniors and juniors, have them return first, especially for students who are seeking to obtain college credits through AP and IB exams. I think having that in-person instruction, if that's what they opt to do, having them come in first would be would help out a lot of students in that way. But also, my first question dealt with the phasing in. So assuming that all the metrics go as planned, would the second semester phasing in be similar to the one happening in January where it's week after week, or would that be a different timeline?
I'll go ahead and chime in, Mr. Asante. The thinking, we really need the results from the parent preferences survey to determine the schedules. So that really is going to drive a lot of the decision making. We hope to give you an overview of the different factors that we have to consider. Once we get those results, we'll have a better idea of the schedule we'll be able to build for students.
All right.
And if I may, Nick, that's an excellent question. The board meeting in December, on December 3rd, will be at the end of the window of the parent survey. And again, I can't impress upon everyone that's listening how important that is for us to build the design. Even though you saw a structured phase-in schedule, based on the numbers of students who indicate they want to come back, we may be able to adjust those timelines accordingly once we know the numbers at each particular grade level.
and making sure that we stay within the safety guidelines in any one of our buildings as we bring students into them.
All right, thank you. That makes sense. And then with my second question about those support staff members that we'd be recruiting, would they be recruited on like a 3-month basis, or would it be like a rolling type of thing? Like how long would they be, how long would we be recruiting them for?
So that's a great question. And so once a staff member is hired into the system, then we expect them to continue, they'll continue with our system. I mean, in the spring, sometimes there are shifts with what their school location could be based on enrollment. Everything's based on enrollment. But generally, once we hire staff members, as long as that enrollment continues to drive that need, those staff members would continue on in the next year with us. So it wouldn't be like, I don't think there's, not necessarily hiring anybody temporary.
All right, thank you. Those are my 2 questions.
Okay, so now we'll go to Vice President Wolf.
Thank you. I just have a question. I guess it's very similar to Nick's. It's about the phase-in for special education. I noticed that you had a February date for phase 2. Unless I missed it, I didn't hear the date for phase 3. Okay, wait a minute.
The dates are going to really be determined by the metrics and how soon we can bring students in and how well we're doing with the students that are there. And then that will help us determine when phase 3 will be going in.
Okay. And
Ms. Wolf, if I may too, one of the things that I know that we discussed in the summertime when we thought that we were going to be able to do an in-person, that's okay, do an in-person model in the fall, was that as we do the first phase, we will learn from that, from the logistics standpoint. I'm sure that there are things that we will plan for that will go okay, and I'm sure there are things that we may have to rethink. So I think that, I know that there may be some concern because we haven't put dates on those phases, but we will learn from that first phase implementation. And it's our hope that we'll be able to do that as we roll out more groups.
Thank you. My second question had to do with the health services. In order to provide nurses, is HHS going to be able to supply them all, or are we going to have to hire directly? How is that going to work? Or, you may not know just yet, and that's okay too, but I was just wondering.
So exactly, that is the conversation that we're having with our colleagues in DHHS. Of course, as we know, and as Dr. Gales will, I'm sure, speak to later, public health is very busy, and we respect that. But we also still continue to have a positive working relationship with them, and they want to support our schools and our in-person services. So we'll be working with them around availability and models. We may also be exploring ways to have other contract or other health approaches to school health services. So there will be multiple models that we can explore. But again, we'll continue to work with DHHS as our first touch point and build out models that are appropriate and make sense. And again, provide that that required service. That's the first, absolutely the first requirement.
Thank you. And I hope first grade is in your early phase in, as you can see. Thank you.
Yes, at this time we'll hear from Mrs. Mondrowski.
So I too will thank you all. I'm very pleased to see the work that's been put into this and the progress that we're making. I'm so glad that we've got a plan coming out and everything. I would like to reiterate Mr. Asante's comments about getting our seniors and our juniors in. Personally, I would do them before I would do 9 and 10. And I understand why we looked at it as those were more transitional years, but these are the years, that 11th and 12th graders really can benefit the most, I feel like, from being in sooner than later. And getting our youngest students in as soon as possible is great too, because I know that that's, a real concern for a lot of parents. As Ms. Wolf just has expressed, it's very challenging having young ones at home. So I don't really have, my questions have been fairly, pretty much answered in terms of the phasing in was really my biggest question, and could we switch 11 and 12 for 9 and 10, or 9 and 10 for 11 and 12, I guess I should say. So I will not keep any more time. Thank you.
Thank you, Ms. Dixon.
Great. My question revolved around slide 31, the phasing as well. And I do understand, from listening why you can't have any dates up there in terms of phase 1, 2, and 3. But I would urge, as soon as you can, discern that to consider putting something there for those who are anxious to have their children back in school. And I realize that, parents will have a choice. It would give them something to look forward to know what those dates are. But we'll leave it at there. But once again, I really am very impressed with the attention to detail with all of this. And I think it's great. Thank you.
Ms. Dixon, I would say, as it stands now, just so our community knows clearly that, the goal is to start the special education and career technology small groups the week of January 11th.
Right.
And then to begin those 3 phases the first day of second semester, which I think is the last day of January. And so, and we'll continue over this series of meetings we're doing now to lay out those dates as we see how we'll be serving different groups of kids, the size of the groups of students, and obviously how our metrics are looking as we move forward.
Yeah. So I'm not sure I'm clear then. So like phase 1, that would begin February 1?
Well, actually, our presentation has 2 phases in it. The first phase is on slide 27.
Okay.
And that's the special education small group phasing, and that would begin in January. And the second,
that one I have. I'm looking at kindergarten in grade 1.
Right. And that's the bringing groups of students in, and that would begin the first day of second semester.
Okay. And then where it says phase 2, are they coming the same day too, or no?
They would come, within our summer plan said 2 weeks, and we'll have to judge that and see what it's going to take.
Right. And then 3 would be then
2 weeks or 1 week
2
after
weeks
that.
after that. Okay. Gotcha.
Logistics. Yep. Thank you.
Right.
And it is our hope to accelerate as we learn more about what we can accommodate and how we can accommodate. As our parents choose the transportation, that's key to our planning and understanding what we can, how many students we can transport into where. And, it's again, acknowledging that we've never done this before. We want to be cautious. We didn't want to put dates because we didn't want to, have lots of excitement and then have to say, we need a little more time. And so we will release those dates as we know more about what we can handle logistically.
Right. Okay, great. Thank you.
Dr. Daka?
Yeah, this was really very helpful and lots of information. I have 2 small questions. Virtual students who would be eligible for co-curricular activities, are we providing that transportation, or we have no idea yet what we'll do about that?
We do not know exactly how that will work at this time. We're just going to have to continue to see what the scale of the number is and who's interested and how that will go. And so.
But we're thinking about that because there's some schools that have no transportation during the day anyway.
Right.
Like Blake and Magruder. Okay. And slide 28, cohorts would be 2 or 3 classes that would meet together, Or do they mean in close proximity? Because there aren't that many schools that have room for more than one class or two classes to meet. I just didn't understand that.
So if I can go ahead, the cohort slide went with the special education discrete programs. And what we've seen is that, these programs need additional staff throughout the day when certain situations arise. And when we're in buildings, it's easy to get people in and out of these classrooms. But during COVID, what they found out is you really want a bubble of once you're in school. And the idea is to have two or three classes of staff members, paraeducators, teachers, supporting the students within those class periods so that they're already exposed to one another and you're not bringing other people in from the outside if there's a situation that arises in those classes. So think of it as like a bubble of extending one class to two or three different classes. So you have adults that are together throughout the day and you're not bringing in other people from the outside.
Oh, thank you. And I just have one other thing I want to say. College Gardens came up, and I want to thank the staff for really preparing us for this. College Gardens is an elementary school, and people may think that we only looked at the elementary when we got the information from our staff, but it was set up for kindergarten, elementary school, middle school, and high school so that we'd have a feeling as to how these classes would be set up and how they'd be conducted. And thank you for giving me this extra time.
Sure. Mrs. O'Neill.
Well, thank you all so much for the in-depth presentation and the thought and research that has gone into this. I'm appreciative that we'll be sticking our toe in the water to bring back children. And I will keep my fingers crossed that COVID-19 doesn't take over and cause a disruption to our plans. I don't think any of us know now, sitting here, what it will be like in January. Things seem to have gotten better over the summer, and now all you have to do is turn on the evening news, and things are bad in places that had gotten it under control. I think there'll be parents out there who are disappointed that we're not just flinging open the doors to all children, boom, all of a sudden. But obviously, that really is not possible now. I don't know whether I missed it in the conversation, the information that will go to parents when they do this survey. Back in the summer when planning had gone on for the hybrid, we were talking about 2 days a week in person, so that we would ensure the smaller groups. So it would be, say, Monday and Tuesday, Wednesday is a cleaning day in the buildings, and then another group on Thursday and Friday. Is that still the model that we're looking at for the general education students?
So that's a great question, Ms. O'Neill. In our study of other districts who have attempted to stand up models, some of which we know they've had to back away from, we've learned a great deal about the structures, if you will, how we should consider doing that. That is in our next portion of the presentation. Oh. We have actually sort of backed away from that model to be more of a weekly delivery, and the next section will go into detail about those considerations.
Thank you, because I thought, in the Dr. Redmond-Jones presentation about the information to parents, I didn't hear it, and I thought, well, what is it that parents are signing their children up for?
Right, then that's a fair question, and the companion guide that will go with the questions, the parent preference questions, will provide that kind of detail. But again, I want to impress upon everyone that it's almost a chicken and an egg. We can say a lot about what we'd like it to look like, but at the end of the day, it's really about the number of people who do choose that in-person experience and how we can maximally provide the best experience for students that do sign up for that. So we'll hear a little more about that.
So I'm going to let Ms. Silvestre ask her question, then we'll move to the rest of the presentation. And then when we have Dr. Gales on, I'm going to ask that each board member, if you have a question, one question. We don't have a lot of time with him, and I want to ensure that whoever has a question, we can get to that question. So let's limit it to one question per board member when we get to Dr. Gales. Thank you. So Ms. Silvestre, go ahead.
Yes, I wanted to piggyback on what Mrs. O'Neill said about the COVID rates in the county. And I want to say this over and over again today in our next board meeting. We as a county have to do everything in our power to keep the COVID rates down. It is so important that we can execute this well thought out plan and bring the students that need to be back in school to school. So yes, I know the rates are going up, but we need to do everything in our power as a county in partnership with the county government, our business community, our faith community, to keep the rates down. Schools are an essential service, and we have to bring some students back. Now, one thing that came to mind when the presentation was being made, it's going to be a hard choice for parents to decide what they want, whether virtual or the models that you're going to talk about in the next part of the presentation. So I can't emphasize enough information, visuals, Q&A sessions, because I got to visit College Gardens, but our parents didn't have that luxury. So just to make a plug for all the things that parents are going to need in order to make a good informed decision about what to do with their students. So thank you.
Okay, so we have Ms. Mondrowski, questions only at this point, everyone.
Yep, sorry, very quickly. My main question is how, I saw that you're going to put different ways that we're going to try and access parents for the questionnaire and the survey, but how are we going to make sure that we are reaching everybody? In other words, if we're not hearing, are we going to be monitoring who's replying so that we can make a targeted effort to reach the people that we don't hear back from?
Well, this is a case, Ms. Smadrowski, where we will have to hear from everyone.
Great.
Because we will need to assign their student either to a physical in school building space kind of program with some virtual learning potentially, or an all virtual program. And then we want to provide all the supports no matter what the parent chooses. So we will need to hear. So if they don't respond to us, we will have to go find them, just like we've been looking for people out.
Very happy to hear that. The only other thing is I just want to make sure that there's a part on there that gives people the option to indicate that they're flexible. So like they might like their kid to go back, but if we realize that it's going to be not reasonable to get everybody who says yes in, if there are, there could be a box they could check to indicate that they're flexible. And then hopefully we consider other spaces like libraries, rec centers, or even outdoor spaces if we need it.
Okay. So we will, at this time, let you all continue with the presentation. That way we can hear from Dr. Gales. Thank you.
So, Ms. Evans, if I could, before we start the slides again, I just wanted to read something that I think fits very well with this discussion from yesterday's Baltimore Sun. This is a quote by Governor Hogan. He said, "Nobody is looking to fill the schools back up with the virus as spread around as it is. And we want to move students back into schools. That's been our desire all along, and we have to do it safely and thoughtfully and carefully, and that means we're going to have to start small and then build from there." And so I appreciated that Governor Hogan made that statement in his press conference or in his answering questions yesterday, because we're not going to be able to fill the schools totally back up. And we have all the restrictions that Ms. McGuire has been talking about. But if we do this and we do it well, and we can keep, as some of you have said, these metrics lower by being very responsible across the whole community, then we can begin to build out our schools in-person learning again. So now we'll continue.
If it's okay, we're going to continue right through the presentation, and if we could take questions after Dr. Gales has completed his section. So we'll turn it over now to Ms. Webster, and then to Mr. Moran, and they'll move right into Dr. Gales' presentation. Thank you.
All right, good afternoon, everybody. Thank you, Dr. McKnight. I want to take a few moments to share with you the instructional models for the phasing in of our in-person engagement. We are going to return to this topic, on November 17th at our board meeting, where we will expand on the student experience as we look at the different ways to match the range of instructional models to our students' needs. As you know, we're currently in a fully virtual remote instructional model where students are enrolled in their courses through virtual classrooms. This will remain an option for all students as we move into second semester. And as Dr. Jones noted earlier, parents may choose to keep their children enrolled in a fully virtual model. In the fully virtual model, students maintain the same schedule and routines and will receive all of their current services. We will prioritize keeping students with the same teacher and classmates, but we're aware that minor adjustments may need to be made to student schedules as we adjust staff to support the in-person instructional experiences. And again, in a fully virtual model, the students maintain all of their athletic club and activity affiliations. Next slide. For parents who express an interest in their child engaging in an in-person learning experience, it's important to note that the virtual learning experience will still play at least a partial role in their overall school schedule. The in-person instructional experiences are designed to support virtual learning. We know these in-person experiences will provide for real-time interaction and support of students. As we design the in-person experiences, we will prioritize keeping students and teachers together, knowing that we recognize that as we move toward implementation, it may depend on student demand and staff availability, and we're going to need to make adjustments as we go. And like virtual learning, again, students who are involved in in-person experiences will maintain all of their club and athletic affiliations. You can see in the chart on the screen that we anticipate the in-person and virtual combination playing out in a couple of ways. First, students may come into school sites to receive access to Wi-Fi and staff support to their virtual classes. Second, students may come into school to work face-to-face with their teacher while other students are enrolled in the same course at home. And third, students could receive direct instruction from the teacher with no remote component for that particular course. An example here would be for our students with the greatest needs, such as those in some of our discrete special education programs. Next slide. To determine which of these in-person models will be used at the school level, we will need the results of our parent preferences survey to determine the student demand and align that with our in-person staff support and consider which approach best meets the needs of the students we're serving. We do not see an absolute approach to providing in-person engagement for our students. Instead, we will use our students' needs to determine which option is most appropriate. It's also important to note that there's no ideal model and that we've never done this before. We are committed, however, to carefully aligning the instructional model with the needs of our students. We will be able to carefully craft the design after we have the parent responses to our questionnaire. Next slide. I would now like to go a little deeper into the description of our support model for in-person engagement. The support model provides the opportunity for us to invite specific groups of students to work with staff on site. The students would stay enrolled in their virtual classrooms, but receive support from a staff member in completing their work and staying organized. This model would serve small groups of students at one time, and there may be opportunities for the support model to provide direct instruction, as in the case of some of our special education programs where students are seeing their primary teacher for in-person direct instruction throughout the week. There may be an opportunity as well to blend a simultaneous model, which we'll talk about more here in a moment, with the support model. The schedule for students in the support model could range from daily to a few days a week to alternating weeks on a rotation, which again will depend on the student demand and staff availability. Next slide. The advantages of the support model include the ability to provide in-person targeted instructional support for specific groups of students. This includes the ability to more fully implement IEPs for our special education students and overcome some of the limitations of the fully virtual model. We would also be able to offer in-person support that can be customized to the needs of students in remote learning. Next slide. Currently, some parents are able to provide in-person support for their children's learning, and our implementation of a small group model would allow us to offer that to more students who need it. We could also bring students in for small group support in cohort groups and engage together, creating relationships among those students. Students would stay enrolled in their current virtual classes, which will allow us to be flexible as conditions fluctuate in cases where we may have to use a fully virtual model again. This allows our teachers to keep refining their remote delivery of instruction while we supplement with in-person support for access to technology, organization, and classwork. Next slide. A few considerations with implementing a small group support model are that we are still relying on the remote delivery of instruction, which may be a challenge for some students. Also, when students are coming to the school site for instructional support, they need to stay with the same groups of students and staff and will need to follow health and safety guidelines when moving locations throughout the building. We also need to consider the health and safety guidelines for the transportation of students, and we need to consider which staff will support students on site, which may mean the reallocation of staff's current roles or the hiring of additional staff. Next slide. The resources needed to implement a support model include staff who can support students while they're working on their virtual classes and coursework, school locations for the students to report to, transportation to the sites, cleaning protocols for the sites, administrative and support staff for on-site management of the operation of the buildings, and considerations for staff PPE. At this point, I'm going to turn the presentation over to Dr. Moran to share more about the simultaneous instructional model.
Thank you, Mrs. Webster. The simultaneous model is defined as the teacher or teachers interacting with students both in person and virtually at the same time. The virtual students join a Zoom session to view a shared desktop screen and a camera directed toward the teacher, while in-person students are seated in appropriately placed desks with their devices. Again, this model provides coherence in instruction from the virtual learner to the in-person learner. We are now going to watch a video to provide you with an understanding of how this model could be implemented.
Today we're going to talk about identifying cause and effect using the text that we've been reading about the Great Depression. What do we already know about cause and effect? Tom, you can unmute and answer.
Cause is the reason something happens. Effect is what happened.
That's right. Good. Thinking about what we've read, what is an example of cause and effect that we can add to our chart? Scott, thank you for raising your hand.
Since businesses lost money, they had to fire workers or close down. The businesses losing money is the cause. Firing the workers or closing down is the effect.
That's great. Let's add that to our chart.
Thank you. Next slide. We will now discuss the advantages of simultaneous learning. A driver for this model in Palm Beach County schools is that this model allows for schools to maintain their master schedule and continue with their current teacher or teachers. In addition, students stay connected to their teacher regardless if parents select in-person learning experiences or virtual only. This model also provides flexibility and creativity in how teachers are assigned. Teachers could be assigned as fully remote teachers or others in person, or through the academic support model that Mrs. Webster just described. Another advantage is that simultaneous learning has opportunities for flexibility in how it is structured. It is a model that can be applied in multiple ways. It can be structured by aligning in-person and virtual teaching, teaming two teachers to teach the same content in different ways to achieve the same objective. The virtual group watches and listens to the teaching and participates only when structured opportunities are provided to engage in discussion or utilize the chat, or the virtual group could receive a pre-recorded introductory lesson the night before to view, and they can discuss it with the teacher to check for understanding while the in-person group watches the same recording. This model also provides an in-person directed instruction for students where remote learning is not meeting their instructional needs. It also provides important in-person engagement and interaction to support the social emotional needs of students. Another significant advantage is that this model can be implemented using a combination of existing technologies while applying low-cost enhancements. Finally, an advantage that has been identified when studying both Sarasota County schools and South Bend County schools has been developing learning partners or teammates that connect an in-person and virtual student to work together on projects and support with questions and discussion. Next slide, please. While there are advantages, we must also consider potential challenges. The simultaneous teaching model requires teachers to consider the modes for engaging students in person and virtually. It also requires intentional planning by teachers for the types of engagement for students who are remote and in person. This planning will be supported by planning and providing the necessary professional development. In Maricopa County in Arizona, they have found the greatest challenge to be aligning in-person resources with virtual resources. Finally, this model will require adjustments, and therefore we must be prepared to make progress and not perfection. Next slide, please. To support the implementation of the simultaneous model requires multiple resources. In regards to human resources, it requires an on-site teacher, ideally with another teacher or staff member to support students on Zoom to manage the chat and engagement. If schools have the ability to develop team teaching, they would need an in-person teacher and a virtual teacher to support those students who are virtual. In addition, a special educator or ESOL teacher may need to be available to provide support to students who receive these services. With respect to technology, on-site support would need to be available from an instructional technology support specialist. Material resources would also be required to implement the simultaneous model. Equipment that will allow the teacher to be mobile will be needed, such as a wireless mouse. In addition, audio and video equipment will be needed to capture the on-site teacher. Next slide, please. We recognize that the implementation of the simultaneous model will require thoughtful professional learning on both the instructional and technological implications. This would be an opportunity for us to construct this professional learning based on best practices that have been identified through the study of comparable school systems that are pursuing similar instructional models. It will also require resources to support students and families to successfully prepare for this learning experience. And I think at this time, we're now going to move to questions.
Thank you, Mr. Moran. We're going to continue on and have Dr. Gales go ahead and share, and then we'll, if it's okay, Ms. Evans, we'll take questions after that. Thank you.
Thanks, Dr. Moran.
So we can continue with the presentation. I'll turn it over to Dr. Gales and Mr. Turner. Thank you, Dr. Gales, for being with us today. Welcome.
Hi, everybody. I actually don't have any PowerPoint slides. I'll make very brief remarks to save time for questions. As you know, if you have been following along at home, we have seen a recent increase in cases both locally, regionally, and at the state level. And we have been working to listening to some of the discussion, looking at ways to enact restrictions that will address those types of things, to be able to arrest the increase in cases, get us turned back in the other direction so that case counts can decrease so we can get kids back into school, among other things, as that is a priority item. One thing I did want to highlight, I did get some feedback that there have been some questions related to metrics, and hopefully this will address some of the questions that you mentioned. The reason why there's so many different ways that the data is looked at is because everybody has a different structure. Ultimately, they equal the same amount of numbers roughly. They're just talked about in a different manner. So even when you look at the reason why we've provided guidance using the CDC criteria, and this actually gets to another point of, well, there's a difference between the state and a difference between what you all are proposing and a difference from the CDC. So the state guidelines use less restrictive criteria when it comes to its measures. So the test positivity, everybody has used 5% as a metric and said below it's okay. Now, when looking at case rates, the state has used 5 to 15. I think that's a broad category. And so when you look at the CDC, they've actually had more discrete categories breaking down those case rates. Because honestly, from a health perspective, when I look at a case rate of 5 to 7 per 100,000, I'm having a very different level of concern versus if I'm looking at it 13 to 15. And so, because right now, for example, we're in the 13 to 15 group, and we're having conversations and we propose implementing restrictions around activities to get that down. That's a very different conversation than what we're having if the case rate is 5 to 7 per 100,000. And so the differences are the CDC, just by definition, and it really is just how it's presented, the CDC guidelines look at the case total over a 14-day period. MDH looks at the 7-day average for daily case rates. So when you do the math, from my understanding, you had the math lesson earlier today. When you do the math, they're approximately the same. They're just presented differently. And the reason why the recommendation was to use the CDC metrics, and similar to that is it makes it easier to compare to other jurisdictions, not only in Maryland, but across the country, to get a sense of the types of things that you're using. For example, looking at the school systems in Washington and Oregon and Colorado and Massachusetts, just to name a few in terms of the recommendations that have been put forward. So that's why the metrics look a little different. And that gives also a little bit of explanation why incorporating the CDC and other states' guidelines, in addition to the Maryland state guidelines, give more context and more specificity to those categories and risk assessments. Again, 5 to 7, very different from 13 to 15. And that helps inform your efforts to move kids back. And particularly, again, those discrete categories make it easier. You know, if we, let's say, for example, we get to a place where we're sitting at 13, we're at 14.8 cases per 100,000 today in terms of average, giving you a sense of the kind of steps you would need to take if you're saying, okay, the numbers have increased, do we need to close things, or the numbers are improving and we can move forward to the next step. So I will stop there and happy to answer any questions that you all may have. Thank you for the opportunity to be with you.
Thank you. I know we don't have much time with you, so I'm going to start with Vice President Wolf. We're asking one question, and we'll circle back around real quickly if we could do that.
I don't have any questions at this time. Thanks.
Okay. Mrs. Smondrowski.
Yeah, I mean, he's kind of touched on it a little bit. My question was really that based on, you know, we've been received quite a few emails and there's stuff on social media that chart different districts and why our determinations seem so much different than other districts.
Okay. So then you don't have another question. Thank you.
Well, I could comment. I do have until about 4:30, but I would like to comment on that actually in terms of the metrics compared to others. I think it actually looks very similar to other jurisdictions. I know that anytime that we put forward guidance from the public health perspective, whether it's related to schools, businesses, closures, or reopening, we work very closely with our colleagues in other jurisdictions across the state of Maryland, as well as the National Capital Region. And in fact, we looked at and studied what they're proposing in Anne Arundel, what they're proposing in Howard County, in addition to those other national examples. So, you know, for those who say this looks very drastically different than in other jurisdictions, it's not very, very accurate, actually, because we, you know, at least when we put forward guidance and provide that to you all, you know, we've looked at other examples close by to try to match up as closely as we can, but certainly take into consideration the specifics of our local jurisdiction to inform that process.
Thank you. I appreciate that.
Thank you, Mrs. Smondrowski. Ms. Dixon?
Oops. Yeah, I don't have a question either, but I did want to thank Dr. Gales for joining us today, and wanted to just share that he is the subject of the interview. I don't think people can see this magazine now. Here it is in this month's Bethesda magazine. And I always find it interesting to know people as a person. And I think this conversation with him certainly will help do that as well. So I would certainly recommend this. And you can even probably go on Twitter and on the Bethesda Magazine's site and read the article as well. But thank you very much for your work. And hopefully, we will get through all of this with the pandemic.
Thank you so much. I appreciate it. And thank you for your work as well.
Thank you. Dr. Daka?
Yeah, I just want to thank Dr. Gales for being here with us. And we really depend on the information that you bring us. So thank you very much.
Mrs. O'Neill.
Yes, Dr. Gales, we had public comment about a month ago from a representative from the Montgomery Medical Society emphasizing the need for all staff and students and community members to get their flu shot. And I've heard you speak at press conferences about the need for flu shots. I've had mine, a high dose. I had to search around to get the high dose. But can you just briefly give your elevator pitch speech about why it's so important to get the flu shot? There may be people even on this meeting who don't believe it's necessary, but especially to bring back kids and staff in January.
Sure. The first thing, thank you for your question. I would like to say I grew up reading the World Book encyclopedias, and I have not seen a World Book encyclopedia in years, so I see it in the background. It's been a while. So that resonated with me. So specifically to your question. So I would like to say before tackling the flu shot issue, what's also important for you all's population is parents. Your kids need to get their vaccines updated. So yes, I know everyone's talking about when we're going to go back to school, what types of parameters go back to school, but regardless of the permutation that's in place, your kids need to be vaccinated. So please, if your kids are not up to date on their vaccines, please go get that taken care of as soon as possible so that whenever the doors are open, your kid is ready to go and there won't be any delays. So, and one of those vaccines is the flu shot. So it's important to get the flu shot because flu, even though we're focused on COVID-19 right now, we know that the flu can hit us hard. And getting a flu shot brings on added protection for you to prevent that illness. That's important because we know that for many, getting the flu for a good portion can end up in significant illness. Significant illness can flood our hospitals and our health systems. And if we do see a continued or a significant rise in cases in COVID, we need those spaces to take care of those patients. And if we see a significant portion of the hospitals compromised because of the flu, then that leads to capacity issues in terms of being able to address the needs of COVID patients should we get there. Now, secondly, particularly for those who are vulnerable based upon how we've defined it, whether it's age or medical condition, getting the flu shot offers you added protection as well to alleviate morbidity associated with the flu or other illnesses, to keep your body as healthy as possible, to prevent, if you do come into contact with COVID, to minimize your disease course as much as possible and lessen the severity of those complications. And the third thing is, which is very important, and another point I didn't address, but when in terms of talking about reporting of illnesses, so if the kids are in school and there's someone who tests positive or someone who has a COVID-like illness, both of those situations you all are responsible to report that to the health department. And the COVID-like illness, the symptoms associated with it, they look a lot like the flu. And they look a lot like other respiratory things. And so if we can minimize the likelihood of folks showing up to schools or businesses and other spaces with those types of symptoms, because if we get a call to say, teacher X or student X came in with fever, chills, all those kind of things, it's treated as a COVID illness until we get test results to confirm that it's negative. And when we get that, we have to provide the same recommendations in terms of quarantining or potentially closing schools or closing classrooms as if it's an actual COVID case. So the more people that get that protection, we increase our likelihood that there's less people who will be showing up with non-COVID cases with those types of symptoms.
Dr. Gales, Jack Smith here. A pleasure to see you. Thank you, as always, for everything you do. I want to go back to your point about vaccines, a very important point. Thank you for making it. I just want to say to our community that we have been granted the opportunity to serve our students virtually, even if they don't have all their vaccines, which makes sense. But once physical schools reopen, we will not be able to allow students to come into physical schools, in-person learning experiences if they do not have those vaccines. So it's critically important, and thank you for pointing that out.
Thank you so much. So now we will go to Ms. Silvestre.
Dr. Gales, I don't know if you were here earlier when I was imploring our community to cooperate with the restrictions so that we can bring our students back when the time comes. But I just wanted to thank you for everything that you're doing and implore you personally to help our community with our public education campaigns and the restrictions that you're going to put in place, which I think are necessary. We are getting so many emails from families for whom virtual learning is not working and their children are really suffering. Mm-hmm. And so we really need to bring our students back for those that this is not working for them. Schools are essential. We know that they're a fundamental fabric of our society. And so everything that you can do with your partners and county government to bring those rates down so that we can do our work is much appreciated. My question is about hospitalizations. Like why is the new case rate the thing to watch? One of our PTA leaders in a meeting earlier this week pointed out, why not hospitalizations? Why not deaths? And just wanted to understand, why is that the measure to watch?
Well, we actually, if folks at home take a look at our dashboard, hospitalization utilization rates are a part of the criteria that we look at. And since we implemented strategies to reopen back from May, that hospital utilization rates, both in terms of who's showing up to the emergency room, who is just in a regular acute bed, as well as who is utilizing intensive care units and critical care type resources, have been a part of our dashboard to guide those discussions. So they've been present. The challenge is it's tricky to look at one particular measure because you've got to look at them in the greater picture, the larger picture in terms of context. And so, we do look at fatality rates. We do look at hospitalization rates. And then we look at how many people or how many cases are out there, because the more cases that there are, and coupled with our rate of transmission, that suggests that, that gives us a proxy of how quickly the disease could spread and how quickly the numbers could multiply and increase. So with that in mind, we don't wait for any of those numbers to reach a critical value. I liken it to when I was practicing medicine and I would run labs on a patient. If we got lab results back that were troubling trends, we didn't wait for them to be the critical value before we took action, because we wanted to prevent them from getting to that point and having worse complications. And so in summary, again, we look at all of those different measures to get a sense of where we stand. Again, not only locally, but we also look across the region, because we know that even though the students may be Montgomery County residents, we know that teachers and staff members come from other parts of the region as well. So we factor all of those things in terms of coming up with the criteria and the decisions in terms of how to move forward. And another thing that's a little bit tricky is sometimes those measures don't always go hand in hand right away. For example, hospitalization rates and fatalities typically lag behind your increases in cases. So when you're looking at the increase in case, you're saying, oh, well, they're not in the hospital yet, or, people aren't dying. The problem is that when the numbers increase, you're increasing the chance that people who are in vulnerable categories may come into contact with it, who may develop symptoms, may end up in the hospital, and ultimately may have complications and COVID-related fatalities. So that's how we look at it in the full context of things and how we track the measures overall.
But for opening schools, why is new cases the rate versus hospitalizations and other measures?
Precisely what I just answered. I think I answered it earlier. Yeah, I think I answered it pretty clearly. And again, when you look at those, when you actually look across the board, the CDC guidelines for reopening, the primary criteria that they mentioned, there are three. The primary criteria are case rates, test positivity, as well as rate of transmission. Those three things are the very same primary criteria that we use on our dashboard. And the secondary criteria include those factors that you mentioned, such as hospitalization rates and things like that.
Okay, thank you.
Okay, and so now we go to Mr. Asante.
Thank you, Dr. Gales, for supporting our system. I guess my one question is that I've heard a lot of, talk and rumors about the fact that winter months and colder months make it the transmission of the virus more likely and also increase the lifespan of the virus. How accurate is that?
Well, it's a little complicated. I know we don't have time to have a pathophysiology lecture, so I'll try to give bullet points. Part of the concern, there's a couple concerns when dealing with colder temperatures. So first and foremost, when it's colder outside, people come indoors. And so, through the summer, we were able to have the advantage of people being able to be in social settings, but being able to space because they were outside. And more people are coming indoor, which raises the concern, ventilation. Are people going to be able to adequately physical distance in those spaces? Are they going to wear face coverings and, be able to adhere to the practices that we put into place? So cold weather brings people inside. It makes proximity harder to distance and proximity harder to maintain. When it's colder as well, particularly this time of year, anyone in the medical field can tell you this is the time where all sorts of things come up. All sorts of respiratory viruses, RSV, flu, common cold, a host of other things that can cause immune systems to be weakened and predispose you, for example, if you come into contact with COVID-19, predispose you to having a worse outcome because your system is compromised because you've been exposed to a host of all these different measures. So from a clinical perspective, I would think about cold weather having that influence on the virus that way. We also know that typically lower humidity can enhance transmission of virus by enhancing the ability to, when particles are expelled and expended in the air, makes it easier for them to stick around and for folks to come into contact with. So that's the very short explanation of to your question. But, we could have at least an hour-long lecture about that to go in more detail.
Thank you.
Okay. So are there any other questions from board members before we let Dr. Gales go? Okay. Seeing none. Thank you so much, Dr. Gales, for always coming in to speak with us. Did you want to make one last comment?
No problem. Yeah, I wanted to address the contact tracing piece because I did get a message to say, can I just briefly do that? So the way contact tracing works is, and we've been able to, since the non-public schools have been open in different capacities over the last couple of months, we've been able to work with them around this. So what happens is if you get a kid who tests positive or a staff member who tests positive, or if they've got a COVID-like illness, what happens is, again, by law and COMAR regulations, the school is required to contact the health department to notify of that situation. And when you notify the staff of that situation, they will step in and help provide guidance around that. They will also conduct the contact tracing exercise. And contact tracing means if you've got cases that have been identified, the staff will work, the staff meaning the health department will work to talk with that individual to get a sense, or individuals to get a sense of who else may have been exposed and be able to provide you all as a school system, in terms of the further actions that you need to take, whether that would be you need to quarantine a classroom, whether you need to close a school, so on and so forth. Now, the guidance within that is specific to the situation. There's no blanket situation to say, if you have one case reported, close the school. It doesn't work that way. There are a lot, there's a conversation with the disease control staff to work with the school officials to get more information. They'll likely request things such as, for example, if a teacher were to test positive, they may request information on the students in that class to get a sense if they were exposed, and if they were, their contact information to be able to reach out to those families who may be impacted. So I just want to emphasize that the expectation of that contact tracing process does not fall on the school. it's the responsibility of the local and state health department, but we would certainly work very closely with the schools to walk through that process, get the information that's needed, and help provide you with the information and guidance that you would need to take as a result of those cases or concerning illnesses.
Okay, thank you so much. So, yes, thank you. And I see no other mics unmuted. I know you're Mrs. O'Neill.
I think you're on mute.
You're muted. You're muted.
Okay. I know the number of cases nationwide for children has increased recently, but I also have been alarmed when I read while children don't seem to die from COVID at the same rates as elderly people. But the issue of MIS-C, have we had any cases in Montgomery County of MIS-C among children?
We did early on in the pandemic, and for those who don't remember, it feels like it's been ages ago and years ago. What you're referring to is this multiple inflammatory system type response. And so they were finding across the country is that you're right, children do get COVID. I mean, they on average have less symptoms than adults and less complicated disease courses, but we have had kids get really sick from it. We have had pediatric fatalities from it. And we did see a host of the MIS-C phenomena happening where they were exposed to the virus and had these really complicated systematic inflammation processes happening in their body. I remember earlier on in the pandemic, we did see a small amount of cases in the National Capital Region, but as best as I can tell, I have not been made aware of any such similar cases in the last few months, to be honest. And even in the setting of, as you're right, there were, particularly in August and September for us, an increase in cases in the 0 to 19-year-old age group, but I've not seen a comparable increase in illnesses such that you described.
Any other additional questions, Ms. Vestry?
If we have one more, if we have time for one more, we've been reading in the news about France and England shutting down yet keeping their schools open. Are you able to comment on why we couldn't do that as well?
Well, I think I wouldn't be the best person to answer. I think you would have to ask, the elected officials about different strategies. And, I think from a health perspective, the verdict is still out in terms of, how effective that would be. We're still getting more data points. France just did their recent lockdown within the last week and a half. And so it's still fairly early in terms of the effectiveness of those strategies. I will say that back in the summer when we were attempting to provide guidance around school reopening, we did look at a number of other places. I think Denmark, the Netherlands, Germany, Israel, and they had mixed results. I think Israel had to some degree shut things down and kept kids in, and it was pretty disastrous in terms of the numbers of cases in schools. And conversely, there was, I think it was Denmark, that had a very, very low community transmission level, very, very low, and were able to open up their schools and at least originally did not see a large amount of cases there. So I think, we'll continue to watch it and see what happens. And if there's certainly best practices that come from that, we would work our hardest to be able to recommend that to you all and communicate that to Dr. Smith and McKnight.
Thank you.
Just as a note, Dr. Gales, Israel had an absolute disaster by opening schools up broadly and trying to keep them open. And when we did some digging and research around Denmark, what we found is they had very small numbers of students in the schools. And so consistent with what we've shared today, starting small and then building based on the health conditions. But thank you for that point.
Okay. Just checking if there are any additional questions that board members have to ask Dr. Yales before he leaves. Okay. All right. Seeing none. Thank you again, Dr. Yales.
Stay safe, everybody.
Absolutely. You as well. And so at this time, we will continue on with the presentation.
Thank you, Ms. Evans. We will have Mr. Turner pick up. We just have a couple more slides on feedback and processes. Mr. Turner?
Thank you. So if we could pull up the slide that says looking ahead, and just a timeline of where we're going from here. And so we're going to be moving forward. There's going to be a board meeting on November 10th. We will launch, as we've discussed, the parents' preference survey on the 11th and have the staff portal open on the 11th as well. We are going to be looking forward to November 17th. We'll come back with more detail for the board and the community. Again, we'll have the special education assessment centers open in December. And the board will have a final plan to review and potentially approve on December 3rd. Going into the new year on January 8th, we'll have, as you discussed, a potential in-person hybrid board meeting. And then the first phase of return for small groups would begin on January 12th. And next slide, please. January 19th, the second phase of small groups would come into buildings if we are meeting the metrics, followed by the third phase on January 25th. On January 28th, the board will have another meeting, and then February 1st, the first group of in-person students, large group of in-person students would come for their experience. And then for moving into the second semester, assuming metrics continue to be positive and we meet that threshold every time, we'll move forward with the second semester. So next slide, please. And we want to hear back from the community. We've presented a lot of information today about metrics, about safety, about instructional models, and we want to hear your thoughts on this as well. So any community member who is interested can submit feedback on this plan and this information to mcpssubmitfeedback.org. We're looking forward to your feedback and your comments as we build this plan moving forward. And so with that, I turn it back over to Ms. Evans.
Thank you, Mr. Turner. And so as we close out of the entire presentation, just wanted to thank everybody for all the hard work that's gone into the plan. We've heard that from several of my colleagues. I just want to reiterate that. And so now what I'll do is open up the floor to my colleagues for additional questions, if you have any, before we close out. And so what I'm going to ask you, if you have a question, do a thumbs up. And okay, so then I'll go to Mrs. O'Neill.
Well, I know we'll be talking about this at repeated meetings, but the issue of simultaneous teaching, I mean, the feedback in districts that have done this, I would think that for teachers, this is going to, I mean, as hard as it has been to do the virtual learning, I would think that it's going to be extraordinarily difficult. And I know you're thinking about that, but I also wondered about the technology for that, because I had seen a presentation or seen something on the news about a school with a camera. And do we think that our Chromebooks and the current technology is going to be sufficient to deliver that method?
Ms. O'Neill, those are excellent questions. I'm going to start out and then I'll toss it to Mr. Moran, who's done a lot of the research on this model. And then we'll have Elise address the additional technology pieces regarding your question. Sorry, the electric went out there. The simultaneous model, as you pointed out, in some districts has not gotten very high praise. One of the things that we know in terms of our instructional design is that not the same design necessarily is going to be warranted for each of the groups of students who come in. So for instance, The simultaneous model may work very well for a teacher who is willing, that has the additional support in the classroom, where the content is appropriate for that type of delivery. And again, there's someone supporting the students virtually and someone who is in the classroom supporting the students who are in front of them. We would not, as a system, recommend the simultaneous model on a wide use basis. It is one of the pieces in the toolbox, if you will, as we think about each individual building and the parents who are telling us that they want to have some in-person learning for their students, very much driven by student need, the course, the developmental level of the students, the teacher's PD, and the grade level, quite frankly. So that's an excellent point. I will toss it to Mr. Moran for additional information about what he has found as he's looked at the simultaneous model.
So it very much supports what Dr. Wilson just said. I think that one of the learnings that we've had in terms of the success and the challenges that school systems have had is that they've committed entirely to the simultaneous model. So they identified it as a one-size-fits-all, and in school systems like Sarasota and comparable school systems like Palm Beach County, which has 169,000 students, having that one model at every school is just is not going to be a success. So I go back to think, not only does it is it based on the needs of the students, the comfort level and abilities of the teachers, the staffing implications, but it also is a decision that needs to be made by individual schools, principals in collaboration with their school communities. And I believe that we have great principals with great judgment that are well connected to their communities that will ensure that they don't approach it from a one size fits all mentality.
And I can speak to the piece on utilizing the existing technology and specifically the teacher Chromebook. So our interest is always in utilizing existing technology whenever possible. It's already set up. The teachers have already been trained on it. It's a no-cost solution. And so whenever we can, we'll look to incorporating those devices that teachers are already familiar with, the Promethean board, the teacher desktop, the teacher Chromebook. But we understand that might not cut it in every scenario. And we don't want to lean into that, at the cost of lesser quality audio or a worse experience for the students who are experiencing the lesson remotely. So we have explored some low-cost solutions, such as what was featured in the video, that can be implemented as needed.
Mrs. O'Neill, I just wanted to add one more thing, if I may. One of the other findings that in terms of success and challenges has been that it's been most successful with teams of teachers. And I mentioned that earlier, but I think it bears repeating. The teachers that have had to manage both the in-person and virtual students have found that they feel like they're neglecting the students that are virtual and that they're having a difficult time managing the discussion and engaging them the same way they are the in-person students. So the idea of having a team of teachers, one who is virtual with the virtual students and one that's in person with the in-person students has proven to be a successful method.
We'll go to, thank you for that response to the question. We'll go to Ms. Silvestri and then to Mr. Asante before we close out.
Just in preparation for the next meeting on Tuesday, I would like to request a chart like the one Ms. Madronsky put up that some other folks have put together. If we could get a chart put together by our own school system that compares the metrics of our surrounding jurisdictions in Maryland and comparable districts in Virginia. We really want to be able to answer the public when they're saying to us that we're being too restrictive. And so I want to have that to share with them to see for myself where we fall in comparison to our surrounding jurisdictions. I did want to ask about the small group support. The support model versus the simultaneous. Are you saying that we're going to have to use both in addition to the all virtual, or will we make a decision later down the road in terms of which of these models we'll be offering?
Thank you for that question. This is where it is. We really have committed to, we cannot pick just one as a district. We, as Dr. Moran and Dr. Wilson have referenced, where we've seen challenges in school systems is where they make a decision at the district level, particularly a district our size, and expect all schools to implement this the same way. We're going to need to see what our parent preferences are, what students are accessing in-person instruction, what their needs are, and which of the range of options best matches them. A lot of these decisions are going to need to be made at the school level, where they know the students, they know their needs, they know their staff. It's definitely it's not an ideal situation where we can rule out one answer, but this is something that's never happened before. We've never done this before, and we just think it's important that we have the people who know the kids and the teachers best work within a range of options that we can support to implement the model.
And parents will still have the option to stay completely online. Is that correct?
Correct.
Yeah, I think that's an important point to make. And finally, my last question is, could you speak about the conversations that we've had with our associations as our partners in doing this work?
I can address that, Ms. Silvestri. Thank you for asking that. So we have been working with our associations, just really sharing the importance of us looking at how we phase in students, but most importantly, looking at making sure the conditions and the operations of how we implement in-person learning is taken at the core of what we do. And so a conversation with the associations have been around how do we prepare our staff to be able to do that successfully. And Ms. McGuire and her team, they have been really focused on professional development so that we are able to provide that to staff prior to having in-person experiences so that they can understand the components and operations of that. We've also shared what we are doing operationally to prepare our buildings with our associations. And so we have just been working along. One other piece I'd also mention is our deliverable teams, which are representatives that our associations have shared with us since we've started planning for COVID, represent a team of our school staff and others who have been a part of the discussion of determining who are our priority groups and what are the things that we should take into consideration as we phase in priority groups for in-person learning. And so our associations have been a part of getting the updates on that work from the deliverable teams as well. And so thank you so much for asking that, Ms. Silvestri. We have been in contact with them and will continue to do so throughout this process.
Mr. Asante?
Yeah, I had a quick question, and I know we'll talk about this more in depth later, but it came up a couple of times. I was wondering if we could get a reminder of what the proposed start date for in-person sports is, just to see how that coincides with the phasing plans.
Our recommendation, Mr. Asante, would be if we're able to bring small groups in the second week of January, that we would start our after-school programs at the same time under the guidelines that are required.
All right, thank you.
Okay, and then one last question from Mrs. Wondrowski.
Yep, thank you. And thank you, Mr. Asante, for asking that question, because I did actually have that on my list as well. But for a follow-up for Tuesday, along with Ms. Silvestri's request, I was wondering if we could get an update on how our childcare centers and learning hubs are doing in terms of any issues that they've had with COVID and any reactions that or necessary actions that have had to take place using them as. And thank you, Mr. Asante, for asking that question. What it might look like when we go back.
To the degree we know that or have that information available, we'll supply it. We won't necessarily, though, have that information or be able to obtain it because I don't know what the restrictions are. Remember, they're not our childcare centers. They work directly under the county government, ICB, working with private providers. And so to the degree we have some information that is legitimate and that we can verify, we'll supply that. If we don't, we're not going to supply information that is
No, I appreciate that. Yeah. Well, I don't want you to make anything up. I'm just saying that I assumed that because they're utilizing our buildings and we are responsible for sterilizing and cleaning them, even though it's through the county that they're accessing them, that we would be notified if there were COVID situations there.
But, and I'm talking about aggregate information.
Oh.
So anecdotal is very hard for us, to share but we will see what is available and what's possible to share that makes sense. In the same light, in terms of Ms. Silvestre's request, if you see some things on social media that you think belong to X county or Y school system, please feel free to send those to us. Okay. But our interest is in verifiable, accurate information. And so we'll share what we have or know about systems. And, many of the folks, very well-meaning with good intentions, who've written to me about everyone opening up, if they've been reading the paper for the past week, what they're hearing is everyone's delaying. Over and over, you see that in the newspaper, delaying opening up. Or actually, a couple of our smaller school systems in Maryland have had to close schools or close substantially because of the spread. So there's just a lot of information, and what we want to really avoid is picking the information that supports our position. Because our position is to be safe and to serve students and families. That's it.
I understand that. I think that it'll be very helpful for parents to know that we have a plan, though, in place with target dates and everything else. And obviously, we can only do what we can do. But at least we know now, and I'm very appreciative of that fact that we know now what our plan is and when we are intending to start. So thank you.
Absolutely agree with you. I think I'm very excited that we've taken this first step.
Me too.
Okay. So thank you all so much for this first half of the meeting. We will come back together again on Tuesday, November the 10th. Our open business meeting will begin at noon. So I will say to you all, have a great weekend and thank you. Good night.
Thank you, everyone.
Okay.